We will continue today with the dialectical behavior therapy. As we mentioned last time, the dialectical behavior therapy is four things. You know, still in the first part, the stress tolerance, which means you cope with the stress. You learn skills to cope with the stress. Then we're gonna in future sessions, we're gonna learn about mindfulness, which means you're gonna learn how to be present and how to experience the present moment without focusing on the past or the future. Then we have emotion regulation, which you're gonna learn how to regulate your emotion and not to be overwhelmed by them and not to be controlled by your emotions. The last part is interpersonal effectiveness, which means that you're gonna learn skills how to set boundaries within a relationship and how to set limits and say no and learn to negotiate. So dialectical behavior therapy is four parts. We're still in the first part, which is learning some skills to cope with stress. According to dialectical behavior therapy, one of the skills to learn how to cope with stress is to find the middle way. And this is a Buddhist philosophy, which is, you always ask yourself, should I accept my life or change my life? Actually, the answer is in between. Like some things you need to accept, some things you need to change. So the middle way is always the best way that lead to peace and love and joy and well-being. Should I work all the time or rest all the time? Again, it is a balance between both. Should I be open? You know, these things are for some people are very easy. Yeah, I know. But for people who struggle with addiction or mental health problems, it's not easy to find the middle way. You need to do it, like you need to pay attention to what you are doing every day to find the middle way. Should I be open all the time or private all the time? Share all my personal information with people or choose certain people to be open and certain people to be very private? Again, it is a balance. Should I work on improving myself or accept myself? Again, there are some stuff we're going to accept. There are some stuff we're going to change. And if you look into the serenity prayer, there are, we ask higher power to let us know what are the things that we need to accept and what are the things that we need to change. Should I be dependent on people all the time or independent all the time? Again, it is a balance between dependence and independence. Should I trust people? Everyone I met in my life, should I trust 100% or should I be suspicious and paranoid all the time? It is a balance. Should I acknowledge my error or validate myself? A balance. Should I follow my wants or my needs? It is a balance. Should I follow my heart or my mind? Like think about stuff emotionally or think about the stuff intellectually? It is a balance. So one of the exercises we will have at the end is you're gonna tell me which area in your life you need to have this balance. Some people will tell me, yeah, it is always a problem between choosing between my mind and my heart. Other people will tell me, it is always the balance between working and resting. Other people will tell me it is always the problem is the balance between restriction in my diet or overeating. So you'll tell me at the end of the discussion what are the areas that you need to balance in your life. So this is a skill we need to learn today, is to create balance in each aspect of our life. This is a pendulum. In everything in your life, I don't want you to be in the extremes all the time. I don't want the black and white thinking. I don't want resting all the time, working or working all the time, independence or dependence. I don't want the trust all the time or suspicion all the time. We need to find the middle way. I'm gonna switch this slide. You're gonna sleep if you keep looking at it. Okay, so we learned to find the middle way. This is a Buddhist philosophy, and it is part of dialectical behavioral therapy. Another skill we need to learn today is radical acceptance. Radical acceptance mean with every life situation, you try to let the anger and the stress, like emotional stress behind the situation. And to explain this, I need to tell you a story that I have like I told this story to my patient maybe tens of times. Okay, if you are new and attending this seminar, maybe this is the first time you're gonna hear this story. So it is called the farmer story. You're gonna learn what I mean by acceptance through this story. So the story tells you that there was a farmer, okay, and the farmer had one son and one horse. So the farmer had a farm and he had one son and one horse. One day he wake up and he couldn't find the horse. So the horse ran away. They didn't know where did the horse go. So the neighbor came to visit the farmer and telling him, this is unfortunate. This is very bad. You lost your horse. How are you going to do your farming stuff? You don't have a horse now. It was helping you. Then the farmer told them, I don't know if this is good or bad or evil or good. I don't know. I'm going to accept life as it is and work with it and see how it goes. Anyway, after a week, the horse came back. And the horse came with 5 other horses, like with 5 more horses. Then now the farmer have 6 horses. Then we don't know, the horse get to know these wild horses and bring all of them. So the neighbors came and asked the farmer again, oh, lucky you, you got, now you have many horses that can help you. You're going to expand your business. You're going to buy another farm. Oh, that's great. Good for you. Then he told them, I don't know if this is good or evil. I don't know. I'm going to accept life as it is, and I'm going to work with it. And they told him, okay, that's fine. They couldn't even understand what he mean by when he responded all the time the same voice tone, the same emotional stability. Anyway, 1 week later, his son was taming these wild horses, was breaking these horses. Then while the son is doing this, the son fell down. And then when the son fell down, the son broke his leg. And when he broke his leg, he needed to be in a cast for 2 months. So again, the neighbor came and told him, oh, this is bad. You see, you got lots of horses, but your son broke his leg. He told them, I don't know if this is good or evil. I don't know. I'm going to accept it. Anyway, after a few weeks, there was a big war in this country, and the government or the army was recruiting all young people from everywhere. And then the army leaders came to this village, and they saw this guy in a cast. They told him, you know what, we can't take you with us. Even he wanted to go with them, but they told him, you are in a cast, you can't come with us. Anyway, and they took all young people in the village except this guy. 1 month later, the war ended, and all young people in this village were killed in this war. So the neighbors told the farmer, oh, lucky you, and your son is lucky. Like he told them, I don't know. Don't know. Even with this, he told them, I don't know if it's good or evil. So you see, with every single situation that is upsetting anyone, that could upset anyone, the farmer was trying to keep calm, and he believed that I don't know if this is good or bad. I don't know if this is really good or evil. And this is what I mean by acceptance. Like, you try to let go of the anger and handle the situation without putting emotional pressure on top of the situation, because getting angry stop you from seeing what is really happening. you will have tunnel vision. The more angry you are, the more tunnel vision you will have. And then you will not be able to make a right decision because of this anger. So we need to let go and accept any situation and work on it. The farmer was not passive, and the farmer was not just laying down doing nothing. He was doing can we mute I don't know where is the noise coming from. So anyway, the farmer was active, was he sent his son to a doctor. He was working when the horse left, and when the horses came back, he was also working and trying to change his business and the farming work according to the help he has. So and he did this by accepting that the situation did happen, and we just have to deal with it. Okay, we don't have to be overly critical. We are a judging machine, especially if you work in a place like you work as a doctor or in healthcare or a social worker or somewhere. When you have to judge all the time, you find yourself you are over judging and you are critical of every single situation in your life. So we need to learn to accept and be aware of our feeling. And when it is negative feeling or judgmental feeling, we need to let it go. So this is the radical acceptance. And to help you practice this acceptance, there is some acceptance coping statement. Like you can use this statement. Something like, you know, this moment is a result of over a million other decisions. Like every single moment is not just a result of one single event. It is a result of hundreds of other events and decisions. The present is the only moment I have control over. Fighting the past only blinds me to my present. It is no use fighting the past. Like stuff like this to tell you, you know, what happened, it happened. Let's focus on the present moment and let go of the negative feeling associated with the present moment. But if you want to practice this acceptance in reality, you know, some people I know that they are overcritical and judgmental all the time. It doesn't have to be judgmental of other people, judgmental of their own selves and for their family and for their, you know, work environment and their partners. So you need to 1 second. You need to practice these skills in something. So I'm going to give you some ideas. For example, you can read the news or read a controversial story in the news and try not to be judgmental. You know, now the news, you find lots of things that are controversial. Try to spend like an hour or 2 hours listening to the news, reading about what is happening without judging it. Also, another opportunity to practice acceptance is heavy traffic. Try to wait without being critical. Another one is if you try to remember something in the past that is upsetting, try to recall the details without judging them. So again, these are the skills that you can try. Read the news, listen to the news without judging them. Try to recall something happened in the past without judging it. I need to admit people. There are misconceptions about acceptance. Okay, you know, acceptance is not approval. You don't agree on or agree with bad behaviors. You're gonna do an action, but with removing the anger background. It is not passivity. It is not suppression. You know, you let go. I don't mean repress your feeling or suppress your feeling. I mean let go. It is not a one-time thing. It is an ongoing process and learning experience. You're gonna take a lot of time. Maybe you can try on minor situation first, then you can try on bigger situation. Let's say you can practice on traffic, or you can practice on reading the news. But then when you have more practice, you can when you get a diagnosis of a disease or of a chronic disease or chronic pain, or you have a mental health problem, you don't need to be judgmental of it and try to accept the situation and work on it. Again, it is also not forgiveness. Like forgiveness is a higher level. We start with acceptance, then maybe some people will be able to forgive the other people that cause them difficulty, and some people will just accept the situation but not be able to forgive. And we talked in previous seminars the difference between forgiveness, which needs more work, and the acceptance, which is less work. It is not liking a certain situation. It is like the farmer. He didn't like or dislike a situation. He just work with life. So these are things that you know about acceptance. Another skill. So we learned today the middle way. Find the middle way. You know, don't be in the extreme. Stay in the middle. You will float to the top when you are in the middle. Also, another skill today from dialectical behavior therapy is a self-affirming statement. Self-affirming statement is you need some statement to memorize or put them on the fridge or on the mirror on your computer, just to give you strength and resilience and motivation. One of the most effective statement is, I love myself. Some people even look at the mirror and they hug themselves or tap on their shoulder or they touch their face and they tell themselves in the mirror, I love myself or I love you. Okay, it's gonna feel very weird if you have lots of shame. Try it today, tonight. Look at the mirror and tell yourself, I love myself, and try to touch yourself. You know, it's gonna feel different for people who have lots of shame and the disconnection from themselves. I am a good person. I am good and nobody is perfect. I have good qualities and bad qualities. These are all self-affirming statements. I care about myself and other people. I accept who I am. These are things that you need to repeat, especially if you have low self-esteem, feeling of inferiority, shame, guilt. I am becoming a better person every day. I'm a sensitive person with rich emotional experience. Every day I do the best I can. I'm here for a reason. Even though I forget sometimes, I'm still a good person. There is a purpose to my life, even though I might not always see it. So you see, it is just affirming statement. So this is another skill that you need to have certain statement. Some people will use quotes, but we need to use, you know, something personal through this statement. By the way, we have an exercise at the end. You're gonna tell me which statement resonates with you. So which one of these, choose 3 or 4 of them that resonate for you, or you can bring your own ideas about self-affirming statement. Another thing is use self-encouraging coping thoughts. You know, we all go through negative experience in our lives. Yeah, some people will have more negative, some people will have less negative, but we all have some way pain or suffering within our life. So we need encouraging coping thoughts. Gonna give you strength, resilience, and motivation. You can choose any of these. You know, this too shall pass. I always tell my patient this too shall pass. It might pass like a kidney stone, but it will pass. So, you know, this is a good thing that anything is temporary. Any problem is temporary. Another thing you can say, you know, the situation won't last forever. I have already been through many other painful experiences and I have survived. My feeling make me uncomfortable right now, but I can accept them. I can be anxious and still deal with the situation. There is an opportunity for me to learn how to cope with my fear or to use any negative experience as a learning opportunity. Again, you can use which ones resonate with you. I have survived other situations like this, and I will survive this one too. It is okay to feel sad, anxious, afraid sometimes. My thoughts don't control my life. I do. The situation sucks, but it is only temporary. So you see, these are most of them. They have the idea of temperaments or life situations are temporary. Whatever they are, good or bad, everything has an end. So you're gonna choose which ones resonate with you. These are examples, for people who use the coping thoughts. The one for like a real examples, like this guy is saying, number 10, I really hate to fly, but I need to go visit my grandmother. So this guy, he has phobia and hate to fly, but he need to visit his grandmother. So to cope with this stressor, he said, this is an opportunity for me to learn how to cope with my fears. I will use my breathing exercise and the visualization skills. So he looked at a negative situation as a learning opportunity. I always say that when there is a problem, three things you need to look at a problem. Look at the problem as a learning opportunity. Look at the problem as a temporary thing. It will not last. Also, with any problem, try to solve the problem or avoid the problem. But if you can't solve it or avoid it, accept it. That's it. These are the three things you do when you have any problem. And most of these coping thoughts are around these ideas. My boss yelled at me, so the employer yelled at him or her. This guy can use, this job stinks, but one day I'm going to find another job. It is only temporary. Stuff like that. You can find a negative situation, find a coping, self-encouraging thought. And you can do the exercise to put a situation here and then to put a coping thought here. Anyway, we are done with our slides, PowerPoint slides, and we have 3 exercises. The 3 exercises are, Brooklyn will run a discussion about these 3 questions. You don't have to answer the 3, just to choose 2 to answer. So the first exercise is, which area in your life do you need to practice the middle way? I told you so many examples. Maybe someone will tell me, oh, the relationship, I tended to be codependent all the time. And if I decided to be in the relationship because there is codependency, I become isolated and stay by myself and suffer with loneliness. I can't find the middle way. So this means this is an area you need to work on. So tell me about an area that you need to find the middle way. Another exercise is, what is a personal life situation where you need to practice radical acceptance? And what would you be the coping statement? So tell me about a situation when you need to practice radical acceptance. Maybe a situation in the past that you say, oh, I should have practiced radical acceptance, or maybe it is a current situation and you need to practice radical acceptance on a current situation. So you tell me the situation and how you're going to practice the acceptance. Another one, tell me which self-affirming statement and self-encouraging statement that resonate with you. Self-affirming statement like, I love myself, I have bad qualities and good qualities. These are self-affirming statements. And encouragement statement are the one that this problem is temporary, this too shall pass, stuff like this. This is just a learning opportunity, I can work on it, like some statement that help you to calm down. These teaching and these skills, it sounds like naive, not naive, like very simple for some people, but to be honest, to put them in practice is very difficult, especially to be a habit. For acceptance to be a habit, this gonna take years of practice. For self-affirming statement to be automatic, like we're gonna work on it consciously now, but to be just automatic, like driving a car, automatic, you do it without thinking about it. you know, it's going to take years of practice. Also, to find the middle way, it's going to take years of practice. So even these messages are very simple, but going to change your life, especially when you put them in practice. I'll give you 5 minutes to think about these questions, and then we're going to run a discussion about them.
Thanks, Dr. Attalla. So for those of you by phone, I'll just kind of read them out one more time. So which area in your life do you need to practice the middle way? Number 2, what is a personal life situation where you need to practice radical acceptance, and what would be the coping statement? And number 3, what are the